morning. Today's remedy is Belladonna. It is a remedy that is very much used in our clinics, and it is a remedy of plethoric individuals, intellectual individuals, and pains, sufferings, and complaints. Comes with great violence. After exposure to cold, stay for some time, run its course, and then go suddenly. It affects the whole vascular system, brain, heart, and nervous system. Belladonna has inflammations of all organs, brain, lungs, liver, intestines, and any other organ. These inflammations are attended with intense heat, unusual, violent heat, pains, inflammations in any part of the body, maybe nightly deliriums, are all attended with violent heat and inflammatory in nature. When that kind of intense heat is present in continued fever, it is not belladonna, because belladonna is not a remedy for continued fever. It has remittent fevers, and in belladonna, fever never comes gradually like in typhoid. It has not gradual rise and fall like continued fevers. But in typhoid fevers, if a delirium that looks like belladonna and you give belladonna for delirium in typhoid, then you may subdue the delirium, but the patient will be worse and he will be sick for longer periods. And in those cases, stramonium can be better remedy to think of for delirium in typhoids. In all inflammatory conditions and fevers, there is redness of inflamed part and the skin is red, but as the inflammation grows, the parts become dusky and mottled. But the first representation is redness. Inflammations of glands of neck, parotid glands, maxillary glands, and throat, and all mucous membranes that are scarlet red and the skin is shiny. And you will see the red points along the glands of neck, red small spots over the glands that are inflamed. It travels gradually toward the zymotic conditions, such as we see in scarlet fever and in low inflammatory conditions, when it grows purplish and mottled. Another feature of belladonna is intense burning. If throat is inflamed, it burns like coal of fire. In gastritis, there is burning. In congestion of brain, head burns, skin burns in scarlet fever, in remittent fever, liver burns if liver is inflamed. In inflammation of bladder, there is intense burning. Another feature of belladonna is swelling. Along with redness, heat, and burning, there is rapid swelling of the inflamed parts, which throbs and is painful to touch. When the children are sick in bed, in congestion of brain, their head is very hot, and if they are able to talk, they will say it burns, and you will notice throbbing of temporal arteries and carotid arteries. Whole system is in turmoil and he is suffering a lot. And you will notice that the bell patients are very sensitive, oversensitive, and so they suffer more than the other people. And everything is shaken up. And you will see the pains of bell that come suddenly, stay for shorter or longer period, and then leave suddenly. It may be neuralgias or inflammatory conditions. They have all kinds of pains: shooting, burning, tearing, stinging, and all the pains of belladonna are worse from cold, motion, light, and jar, and is ameliorated by wrapping up and in warmth. In headache of belladonna, that comes suddenly with violence, and if you touch the head, it throbs, and the patient is worse from jar, motion, even the motion of eyeball aggravate, turning the eyes, going upstairs, and he is better by wrapping up and warmth. The patient is very much aggravated by jar. If you go to the bedside of the patient who is suffering from inflammation of liver, or he is having a pain in abdomen, or there is inflamed uterus, and he will not allow you to touch the bed. So much is the aggravation from jar. A woman in confinement, when there is no inflammation, is in a state of hyperesthesia, that she wants all the windows closed. A little jar aggravates. She doesn't want to be touched, even doesn't want her bed to be touched. She is in such a great sensitivity, and you realize that she is going to have a very difficult and painful labor. In that case, if you prescribe belladonna, everything will be settled, will be at ease and comfortable. Jar of the bed will reveal you the nature of belladonna. If you walk to the bedside of the patient suffering from gallbladder colic with violent pains and skin burns, patient says that, "Please, doctor, don't touch the bed." Such is the sensitivity of jar in belladonna patients. Spasms, general or local. Spasms of little canals. Circular fibers of tubular organs like in gallstone colic. It may be in cystic duct. The circular fibers that clutches the little stone and will not let it pass. And after a dose of belladonna, spasm let up and it passes with ease. When there is extreme sensitivity, it is belladonna. Convulsions in children are violent, usually in cerebral congestions and fever, brought on by light and motion and exposure to cold. All pains and sufferings like brainia are aggravated by motion. Mental symptoms of belladonna are dreadful. In fevers, in maniacal conditions, and in deliriums. Excitement, violence runs throughout the remedy, and there is never a passive kind of delirium in belladonna. Mental symptoms are all active. He is in a wild state, striking, biting, running, and breaking things, sees ghosts, spirits. In early parts of the fever, there is violent delirium, and as it passes, then he goes to sleep, half slumber, a semi comatose sleep, dreams of horrible things, sees fires, screams out in sleep, nightmares. He is in delirium and in torment. He becomes stupid sometimes, and he seems to lose his consciousness. His delirium goes on even during sleep. These symptoms often occur with cerebral congestions, a violent cerebral congestions of infants. In Bell, infants usually remain in stupor. Face is red, skin is hot and dry, pupil dilated and throbbing carotids. Finally, the child becomes pale and stupor increases and neck is drawn backward due to the contraction of neck muscles. He rolls his head, staring eyes, dilated pupils. This mental state is associated with scarlet fever and cerebrospinal meningitis. Again, the mental state will take the form of acute mania, when the patient will bite, will bark like a dog, or run, or even jump out of the window. And in this stage, the patient must be watched and controlled, and sometimes tied. All sorts of delusions and hallucinations are mingled with acute mania, and he wants to do the violence. And along with this, during the whole phase, he will have his head very hot and hands or feet cold. Running through the complaints, whether it is delirium, pains, or fever, there is starting, that is the electric like shock in sleep, starting in sleep. It is very prominent symptom in belladonna. And one more peculiar thing is that by eating something very light, he feels better in mental symptoms. There is fear of imaginary things, and anxiety is also very prominent. But along with all these symptoms, must remember heat, redness, violence, and head is hot and feet cold. Bell is oversensitive, means a state of hyperesthesia, that is the increased irritability. So this results in increased sensitivity to impressions, to light, to touch, to jar, just reverse of opium, where this sensitivity is deprived. More congestion is in belladonna, there is more excitability, more nervous irritability, but in opium there is more congestion and less excitability. And Kent says that it is very much difficulty in distinguishing the belladonna and opium in congestion of brain. They appear to be very similar in regard to face, eyes, and pathological conditions, and they antidote each other. Kent says that if he were to prescribe on pathological state, congestion of brain, the appearance without taking intensity into consideration, it would be very difficult to distinguish between belladonna and opium. Vertigo with increased irritability, vertigo with pulsations, and aggravation by moving the head, moving the eyes, jar, cold exposure, and patient doesn't want to touch his or her hairs, cannot comb the hair. Hair feels so sensitive, scalp so sensitive, hair as if pulled, headaches all kinds, shooting, pulsating, tearing, stabbing, brought on by exposure to cold or by hair cut. And they are aggravated by movement of eyeball, winking the eyes, or motion, turning the head, or by moving the neck forward or backward. And they are ameliorated by tight pressure. There is expansion sensation in head, and sometimes the headache is also brought by haircut. Ear troubles, chest troubles, rheumatism, that is brought on by exposure to cold, standing in cold air, or from haircut. Complaints of various parts of body like rheumatism, they all come after exposure to cold to head or uncovering the head in cold air. by getting head wet. Inflammatory conditions of all tissues of eyes and lids with violent pain. There is redness, throbbing, pulsations and great congestion with photophobia and flickerings before eyes. There is great lacrimation and sometimes strabismus happens in congestion of brain. And this acute kind of strabismus can be cured with belladonna when it is due to the congestion of brain. But if it comes gradually, then there is a need of a surgery. Pains of eyes are aggravated by motion and light. The complaints of belladonna are generally ameliorated by rest and aggravated by motion. But there is a peculiar kind of shooting or tearing pain from hips downward is very painful, keeps the patient moving all the time. In aconite and pulsatilla, complaints come on after getting feet wet and complaints go below upward. Rustox has complaints after getting wet, but he has complaints in the same part. Those are wet. Suppose he wets the legs and then he will have rheumatism. In some remedies, exposure to feet to an icy cold draught will bring on headache like silicea. But in belladonna, exposure to head will bring on neuralgias and other complaints. In inflammation of ears which go to suppurations, belladonna is very rarely useful. Now we come to the mucous membranes. All the mucous membranes of belladonna, nose, throat, larynx, chest, ears have dryness, great dryness of all mucous membranes like phosphorus. And there are other symptoms, that is hot head with cold extremities, cold feet or hand cold with hot head. There is redness, burning and after checked secretions there is aggravation. Whenever we have checked secretions, we have fever with red face, hot skin, cold extremities, and belladonna is only useful in acute conditions with whitish thin mucus, which suddenly suppressed and there arises fever. But when a thick yellow mucus after exposure to cold is suppressed, then belladonna is worthless. Then there comes remedies like moxol, sulfur or pulsatilla. Violent face aches, tearing, throbbings and much pain in face, worse on right side after exposure to cold, with heat, redness and throbbing carotids. Belladonna has cured paralysis of face also, but causticum is a remedy for paralysis of face after riding in a cold wind. Hoarseness, rawness, clutching at the throat, there is acute laryngitis with great sensitivity, aggravation by slightest effort to move, moving forward, backward or by swallowing, and there is asthma of hot, damp weather. Belladonna cough comes from clutching the larynx. Short, spasmodic cough, barking cough, more at night and less in daytime. It is a remedy of whooping cough with spasm at larynx which causes a whoop. There is difficulty in breathing and after a long cough there raised a slight expectoration which gives momentary relief. Again air passages become drier and drier, again a spasm, and this is why it is called paroxysmal cough. There is pain, soreness and tightness, and child cries before the spell of cough. Child dreads to cough because of the pain and suffering. By the child cry, we know it is going to have a cough like Bryonia, Hipper and Phosphorus, which have this same feature more than other remedies. This remedy cures pneumonia and pleurisy in bell constitution with hot head, red face and burning. Belladonna prefers right side like Bryonia, but Belladonna cannot lie on the painful side, and jar aggravates. Slightest movement aggravate. Whereas in Bryonia, he prefers to lie on the right side, that is painful side, and pressure ameliorates, and is not so sensitive to jar and has not much heat and burning. There is craving for lemons, lemon juice, and thirst for beer, and there is excessive thirst for cold water. In stomach and bowel, we have inflammatory conditions after getting chilled, and the patient has cramping pain, violent pain with red face, heat, and burning. Sometimes it is relieved by bending forward, and sometimes it is relieved by bending backward like diascoria. Mother finds it on holding the child in their hands that he is better by bending forward like colocynth. But colocynth is without fever and without thirst and is ameliorated by bending forward, and the pain is on one spot, ameliorated by pressure. Hard pressure ameliorates in colocynth. Whereas in Belladonna, distress colic that is increased by slightest jar, slightest movement and slightest pressure aggravate, and the patient has red face, hot head, cold extremities. Similarly, great pain in ileocecal region, dysentery, diarrhea with much redness of the face, fever, heat, violence, and sensitive to jar, to motion, slightest touch, and with hot head and cold extremities. Hemorrhoids are also very sensitive, sore, painful, and patient has to keep their legs wide apart to avoid the touch. It has cured inflammation of bladder with much irritability of urinary bladder with heat and burning micturition and dribbling of urine with much heat. Belladonna is a great hemorrhagic remedy, bleeding from all orifices. Uterine hemorrhages with great spasm and great soreness with copious flow of blood mixed with clots and fluid blood, which is hot to feel. The uterus fills with a clot, and then comes contraction, a labor-like pain which expels the clot, and after a while there comes a copious flow of fluid red hot blood, and then again there is clot, contraction like labor pain comes again and expel the clot, and then again comes fluid copious hot blood. In this way it goes on, and making the patient very exhausted, very weak. Hemorrhages are in connection with abortion or whatsoever the cause is. There is great sensitivity, sensitive to jar, to motion, and sensitive to touch with fever. And sometimes fever is relieved after hemorrhage is established. It is a great remedy of hemorrhages after confinement, where the blood is hot, lochial discharges are hot. Belladonna is known to relieve hourglass contractions and is useful in painful menstruation, in violent dysmenorrhea. Pains like labor, violent pains, and the lady will describe it as if a uterus is tied up with a string. There is pain with the appearance of menses. Usually, right ovary is more affected because it is the right-sided remedy. Characteristics pain of belladonna comes suddenly, stay for a time, and then leave suddenly. Acute inflammations of uterus, enlargement of uterus, prolapse of uterus. The patient describe it as funneling sensation or uterus will escape out. There are expressions of a woman suffering from prolapse with great sensitivity. Sensitivity to jar, to touch. Neither she can bend forward nor backward because the slightest movement aggravates. She cannot lie down. She has to sit, and she sits with wide apart legs. So to avoid the touch of that part. The vulva is very sensitive and the neck of the uterus is very sensitive. Even slamming of the door aggravates. Inflammatory conditions of breast. There is milk fever. There is great redness of breast. Sensitive breast, sensitive to jar, to touch, to motion. There is face that is red. Throbbing carotids. Bell will stop the pain in few hours and it will stop congestion and sufferings. When mammary glands are inflamed without any general symptom, then phytolica is the remedy. Bell cures inflammatory rheumatism after exposure to cold. It affects all the joints with considerable fever, swelling and heat of the face, redness of the face with much sensitivity, sensitive to jar, sensitive to motion, and patient wants to lie still, perfect still. He wants warmth, warm room and covering. Bell has symptoms so much like old-fashioned Sydenham's disease that it is almost considered similimum, that it is one of the most frequently used in scarlet fever. Majority of the case will be bell cases with extreme intense heat, red appearance of the face and burning. If bell is not administered, it will grow darker. Here it differs from apis, which has the rough rash, whereas in bell there is shining red rash. And apis patient is ameliorated by uncovering and in cold air and has no thirst, whereas belladonna patient desires cold water. He has dryness of mucous membranes and he want to sip small quantities of water frequently. And belladonna aggravation is afternoon aggravation at 3 o'clock. Fever suddenly rises and then aggravated at night. And fever rises rapidly. Sometimes it is 104 and sometimes it is 105. It runs down almost to normal but not with complete apyrexia. It is not suitable for the complaints that has complete apyrexia. For that marks complete periodicity which belladonna doesn't have. Heat, redness and burning characterizes the belladonna. Belladonna has smooth, shiny red rash, not the coarse rash. First bright red and then gradually grows to bluish or dusky. It is not suitable for erysipelatous inflammations of skin and deeper tissues, which forms vesicular eruptions like Rustox. Belladonna is an acute remedy in plethoric, plump children that take cold easily. They get cold, coryza, sore throat, headache after exposure to cold. Suddenly come down with congestions, and belladonna will take care in acute phase. And after that, we have to follow it with calcarea cough, which is its natural follow-up and chronic remedies.